Right, I'm sorry.
Just use this screen. This one?
You can use it.
Okay. Hello, everyone. My name is Dr. Gabriela Fernandez. I'm a professor at San Diego State University in the Department of Geography. I'm also director of the Metabolism of Cities Living Lab, which we're one of the organizers for this event. And I want to share this work that we've been doing during the COVID period. We started in March of 2020, and our work has continued until the early 2021, where our research mostly focused on the country of Italy. We wanted to look at the different geographies of in the north, the center, the south, and islands, how they were being affected during COVID. So here you have a list of some of my colleagues that were also involved in this research, along with the Center for Human Dynamics in the Mobile Age. And we couldn't have done it with Crowd Fight COVID-19, which was an organization that allowed us to, let's say, work closely with different volunteers. Carol Maione, which is also here in the audience, who was also a collaborator in this project. Karenina Zaballa, Dr. Jarai Carter, Harrison Yang, Norbert Bonnici, as well as Dr. Ming. Dr. Ming. Okay. So now I will be showcasing the work that we have done. In this case, we developed also an international COVID survey. We wanted to understand how people were feeling during the COVID period in these different areas of Italy. This is what you see here are pictures of our team members. We were composed of different, let's say, researchers, scholars, PhD students, graduate students from different places around the world, from Italy, Spain, Malta, New York, San Diego, London, Taiwan, Philippines, Korea, Australia, and more. We all came together to develop this research in Italy. And here you can see the different organizations that we're a part of. In the, let's say, in the period of COVID, we developed several different research papers, not only developing, let's say, findings on the international survey, but also looking at different sentiments that were happening during this period of time. Using Twitter data, we wanted to look at the different geographies in the North, Center, South, and Islands to understand what tweets were related to fear, anger, and joy during this period of time. We looked at 10 metropolitan cities in Italy and tried to understand how people were feeling and if they were upset or angry at their governments based on their policy measures. So here you can see some of our projects and different events that we participated. We also myself, as well as Carol Maione, we presented our findings in at San Diego State University graduate program in big data analytics. And so this particular research, the idea is to understand how people were feeling during this period of time. This type of information can definitely help public health organizations and decision makers to make better decisions on how to tackle such, let's say, events such as COVID. We can understand the different individual symptoms, social behaviors, well-being perceptions, and policy trust related to COVID based on different geographies. Okay, so we all understand what was happening in Italy. It was one of the hardest hit countries around the world. The whole entire world was watching. And in this case, we decided to develop an international survey to better, let's say, comprehend what exactly was happening, if people were being affected in their well-being, their social habits, if they were depressed, and so on. We developed a survey of 77 questions with in this case, we're only presenting now the findings for Italy, but this was part of a larger project that involved 24 different countries from around the world with 351 participants. And the data was collected from April 20 to April 2021. We used a tool called Esri ArcGIS Survey 123 in order to keep track of all the data that was being collected during this period of time. And the questions focus on the COVID-19 effects, the behaviors, the well-being, health, different questions on health and aspects, as well as policy measures. So here you can see some of the different areas that the survey was, let's say, taken in the north center of Italy. The questions focused on these 4 different categories, from population questions, public health and well-being, policy, technology, and data. So we can start, let's say, with our participant findings of this research. So the predominantly the questionnaire was 53% majority being men. Concerning their educational level, we had about 29.7 who had professional degrees. We had 20.3 who had bachelor degrees, and 18.8 who had doctoral degrees based on our small sample. Concerning household side, we wanted to understand if during the COVID period, people were living in their homes with 2 or more people. So the majority of participants reported 2 people residing in their home, including themselves, with 29.7%, followed by 3 people in a home with 21.9%, and 4 people with 21.9%. So we can see here that the majority of people had 2 different people, two people in per household. And we also wanted to understand if during the COVID period, people felt the need to move to feel safer. So we had 18.8% of interviewees indicated that they relocated to a new residence to lower the risk of exposure to COVID. Other findings that we asked were what kind of behaviors they use on their essential behaviors. So here we can see that 78.1% went out during the COVID period only for grocery shopping, while 35.9% went out for to the pharmacy, and 29.7% were out for to exercise, and 39.1 indicated they go shopping at the grocery store once a week. Also less than once a week with 32.8%. We also wanted to know if during the COVID period, people were using the delivery service. I know that in some cultures, it's more, let's say, predominant than others. So we found that 39.1% use delivery for groceries or a drugstore once a week, followed by less than once a week with 32.8%. Thus, 42.2% never use food delivery service for prepared meals. And we can understand that this could be also based on age groups and so on. And also what kind of behaviors they were, let's say, doing during COVID, what kind of non-essential behaviors. So 57.8% of respondents did not eat at restaurants, while 73% did not attend public events. And this is definitely seen throughout Italy. Also, physical and social distancing behaviors. We wanted to understand if people were staying home, if they were going out with friends, and so on. So here we can see that 56.3% stayed home, while 67.2%, I cannot see it. Can you? 67.2% did not attend social gatherings, while 46.9% kept a distance at least 2 meters around others, and 67.2% washed their hands more frequently than months before. Other participant findings in our survey, we found out that 45.3% of participants reported to be excellent in their health, while 39.1% reported good. We also asked questions regarding to the if they were exposed to COVID in their own communities. We found out that 70.3% reported they did not know anyone within their community who had contracted the COVID-19 virus. And then we also wanted to understand if they had any COVID-19 symptoms. So 1.6% reported to have a fever, with high temperatures, while 9.4% had a cough, 1.6% had shortness of breath, mostly difficulty breathing, and 6.3 had muscle ache, 4.7 confusion, 21.9 headaches, 3.1 sore throat, 7.8 runny nose, 3.1 chest pains, and 1.65 diarrhea. We also wanted to understand if this our small sample had any type of pre-existing illnesses, and 64.1 did not, while 20.3 did not disclose this type of information. In addition, within our survey, we wanted to understand how people felt about their government. We wanted to know if they were happy with some of these COVID policy measures that were happening within their own communities, if they trusted their government, if they actually followed the social distancing measures that were being taken place within their own communities. And we found out that 53.1% of participants believe the reaction to their local governments to the current coronavirus outbreak is appropriate, while 21.9% believe the reaction is somewhat insufficient or not at all sufficient. Concerning the government trust, we found out that 64.1% felt strongly or somewhat trust within their local governments to take care of their citizens, while 65.7% believe very or somewhat trust their local governments from the corona outbreak. Concerning the social distance measures, 76.6% of participants believe the social distancing measures in their own community, for example, general curfew, are very effective to slow down the spread of the COVID-19 pandemic. Concerning emergency timely measures, we wanted to know if how they felt how they felt about their government, let's say releasing these different policies based on different times. 45.3% of respondents believe the government launched the emergency response measures too late, while 42.2% believe the government launched the measures at the right time. We also wanted to understand if people felt positive or negative about getting vaccinated during this period of time. Again, this is back in 2020, 2021. 31.3% at the time were willing to get vaccinated, while 31.3% were very anti-vaccine. We also asked people if they were using public transportation at the time, and we found that 21.9% avoided riding public transportation, while 1.6% continued. And we also wanted to understand which were the most important current events at the time of the COVID period. We found out that 12.5% reported fake news as the most important topic to discuss, as several different remedies to fix COVID were happening, and different other, let's say, conspiracy theories were happening. And additionally, we asked people if they created a new hobby or bad habits, or they changed their diet during the COVID pandemic. We found out that 50.1% got a new hobby during this period of time, while 15.7% restarted a bad habit. So that's quite interesting. And 40.7% changed their diet. We also wanted to understand where people were getting their information relating to COVID. Were they using Facebook? Were they using Twitter, Instagram? So we found out that the majority of our participants use Facebook as their main platform, social media platform, to discuss COVID, while 42% use Instagram, and 26% use Instagram. We also wanted to ask if how they felt during this period of time, their health, their wellness, if they had anxiety, depression, psychological behaviors. We found out that 51.6% reported is strongly or somewhat nervous when thinking about COVID during this period, while 46.9% reported strongly or somewhat calm and relaxed. Thus, 37.5% reported strongly or somewhat worried about their health. A total of 59.4 noted strongly or somewhat worried about the health of their family members, and 36 reported that they were stressed, strongly or somewhat stressed when leaving their house.
2 minutes.
Thank you. While 62.6 showed little interest or pleasure in doing things, and 50% felt sad, depressed, or hopeless. We also asked participants if they had issues with sleeping. 53.2% had trouble falling asleep, staying asleep, or sleeping too much. 59.4% felt they had fatigue, felt tired, had little energy, and 35.9% felt they had poor appetite or overeating, and 36% felt bad about themselves. 48.5% had trouble concentrating on things such as reading the newspaper or watching TV. And concerning the mental well-being, 20.3% more speak slower and become fidgety. So in conclusion, Italy has been overwhelmingly impacted by COVID, and this type of survey can definitely be useful to understand a snapshot of what was happening in Italy during this period of time in 2020 and 2021. It helps, let's say, government officials better understand their citizens, not only how they felt through their mental health and well-being, but also different measures that they can develop during this process. And let me go back. And just for future work, we hope this type of research can be used by other researchers to compare the different phases that occurred in Italy between phase 0, phase 1, phase 2, and phase 3, and expand the international survey to multiple language, compare well-being, policy perceptions, public health, policy management between countries, and analyze the preliminary findings based on geography, as well as increase our number of samples. Thank you very much for your time.
Thank you, Gabriela. I'm sorry for for my mistake. I'm very happy to have several public health topics treated by several authors, African data, and I found very interesting the last communication, because society and information, good information, good communication as pillars of a good public health. We have today, I think, a planetary One Health, and so I pass the word to Domenico.